have another speaker with us today who I'd like to introduce you, Dr. Victor Leung. He's currently the Medical Director for Infection Prevention and Control at Providence Healthcare. He's also the medical lead for the PHC Antimicrobial Stewardship Program. So Dr. Leung, I hear that you have been using rapid testing in long-term care homes. Can you speak about that a little?
Well, this is just a pilot project that's been, we're starting up with some of the details and building up the foundations to make sure that the test works in ways we imagine it should in our long-term care facilities. So in collaboration with public health, we've been allocated a certain number of rapid antigen tests to be used for healthcare workers in long-term care facilities. And the idea is that we would be doing it at a frequency that is acceptable to the care home, depending on the staffing level, as well as the acceptability to the staff, up to 3 times per week, but at minimum once per week. Now, the program is voluntary, so it's not a mandated test where all healthcare workers must do the rapid test in order to work. The testing is offered on site and done by their trained staff who, at the beginning of the shift, in addition to asking about the symptom screen, which has been going on for many months now, to identify individuals with symptoms and then referring them for testing. Instead of just offering symptom screens, we have the rapid antigen tests for asymptomatic staff. So these are for staff who deny having any of the symptoms on the list, and they are offered the test using a nasopharyngeal swab. After the swab is done, they proceed with work, but the testing can be done pretty quickly, generally within 20 minutes. So if the result is positive, that worker will be called back and another nasopharyngeal swab will be performed for the traditional RT-PCR gold standard. If the results are negative, they're recorded and the healthcare worker can continue to work. And subsequently, the next time it's done, if it's on their shift, if it's a shift that they're working, they'll also have it repeated. So our goal is probably up to 3 times a week. We're not sure if we'll be able to do that successfully and what the uptake rate will be in the longer term, but there will be a reassessment of the pilot in 3 months at midterm to see, and as well as 6 months. We're hoping that as the pilot goes on, we don't have to wait for complete results before expanding this to other long-term care facilities, because the province has been allocated a certain number of rapid antigen tests and we hope to deploy them.
And what are you hoping to achieve with this pilot study?
So the main goal is to identify healthcare workers who are positive on the rapid antigen test, which suggests to us that that's their most infectious period as well, because the rapid antigen tests have low sensitivity, should be picking up individuals during their infectious period. And by doing so, exclude those healthcare workers from possibility of propagating the disease when they're working.
I think one of the things that the powers that be worry about with mass testing this way is lacking workers. Has that been an issue yet?
So the problem is staff, long-term care staff are already limited in that we are having shortages, but it becomes a vicious cycle if we think that by doing the testing and picking up workers, we're going to have shortages. I would say that by not doing testing and allowing for unidentified transmission and uncontrolled transmission with potential for more outbreaks, that would lead to more problems, including both to other healthcare workers and to residents in the long-term care facility. Because even with our best practices, transmission is possible if a person is asymptomatic, and the risks are high by not identifying that.
Absolutely. Letting the virus spread never works out as a long-term game plan. All right. Does anybody in our audience have any additional questions? I think I have one here. Based on your experience, what would you like to see happen with rapid testing in long-term care homes, like in an ideal situation?
I think in an ideal situation, because these point of care tests are quite simple to use, what I would like to see is that healthcare workers are given these tests to self-administer. The testing right now for collection is nasopharyngeal swab, but we can look at alternative ways. And this bilateral nasal nares is also an approved method from the company, one of the companies for these manufacturers of rapid antigen. And so if healthcare workers have to test themselves at home, they don't have to go through the trouble of getting to work, waiting for a test result, wondering if they'll be called back and told not to work. Rather, they can do it themselves at home. Take a picture, for example, document the results, and then proceed with going to work if negative. Some countries have already used this approach. There are arguments that, well, maybe the healthcare worker wouldn't be telling the truth or might not do it properly, but I think we can come with these challenges, improve uptake and scale up this rapid antigen testing by making it more convenient for healthcare workers in high-risk facilities like long-term care.
And I also think the argument of, let's say someone does lie, you still wouldn't have caught that person anyway if you weren't testing them. So better to catch most, and maybe, there will be one or two people that don't play the game properly, but it's still better to catch most of the infections than to not test for them at all.
Agree. And plus, yeah, and this is also just a voluntary program. So you would hope that people who volunteer for it would follow the instructions. Yeah.
Right. All right. And another question, have you been given a test to run your pilot? Is supply an issue right now?
Supply is not an issue to my knowledge, but the information we get is from the lab agencies, and so we don't have exact numbers, or at least I don't have the exact numbers to know what the supply is, but we've heard that it should not be an issue for scaling up to long-term care facilities.
Great. And just to wrap up, the last question, what policy change would you like to see come into place to advocate for long-term care homes?
I think that there's arguments both ways, and I don't know the final the answers to what is the right thing, but I have relatives in long-term care, and one of the biggest challenges is the restrictions that have been imposed now make it much more challenging for their kind of daily life, in both connectivity to relatives and even interactions and activities within the care facility. So I think that whatever we can do to improve the ability to identify individuals in the pre-symptomatic phase, just like with rapid antigen testing, we might be more liberal than what we're permitted to do. These tests, for example, could be applied to visitors as well, and setting some limitations, but not to the extreme where in some facilities it's been very challenging for any family member to go in on a regular basis. So I think that using these tests can help facilitate more interactions and activities that residents can have.
Absolutely.
And,
give them their quality of life back. All right. Well, thank you so much for joining us, Dr. Leung. And I think that's it for today.
Thank you.